Well, the nursing shortage has existed for over 10 years in the entire industry, and the COVID epidemic really exacerbated it to a level that no one could have anticipated. With a declining pool, we had to come up with a different type of idea to help supplement that effort. So the light bulbs went off. Why don't we try to develop a training program that could get younger practitioners interested in palliative care?
So we began a program of a practical nurse residency program. And for a 1-year period of time, they participate in an extremely specific and important educational curriculum related to palliative care and hospice. They spend 6 months in an internship here at the hospital, and then go on after that 6 months to experience community-based care with mentors and preceptors by their side to give them expert and practical experience.
Nursing in general is a lifelong process of learning. It never stops. Healthcare keeps moving forward, and Calvary has absolutely responsibility to educate. It really is organizational commitment to all of us to move forward.
The purpose of it is to provide a steady pipeline of nursing staff, knowing that they have had the best experience they have for education and are expert in the services that they provide to our patients.
The nursing residency program really fits perfect with the historical mission of Calvary Hospital and the Palliative Care Institute, which is to take healthcare workers early in their training, teach them Calvary's model of palliative care.
So our recruitment initiative was extremely robust. We reviewed over 47 resumes for this program. And so we are very fortunate. The residents that we have were very diverse. We have 2 who are brand new graduates. We have 2 who are career changers. We have a tremendous age range. So currently we have 5 residents in our program.
I got my start as a nurse, as an LPN, working at a facility specializing in taking care of patients with HIV and AIDS. That's a highly stigmatized community. And a lot of them didn't have family members. A lot of them died alone. Sometimes, like we'd be in the room holding their hands. We'd be the last person they saw before they passed away. And it was there that I realized that it was a calling for me, and I decided to apply.
This is the second career for me. I did work previously in banking and finance. As a new nurse, I just graduated last year in 2021. So this was really designed for me to really, begin the journey with my nursing profession.
Our faculty are an incredible group of talented individuals in medicine, nursing, social work, chaplaincy, just across all of the different professional domains that are here at Calvary.
There's a lot of knowledge here, so it's a lot to soak up, but it's something that we're all very grateful for. We're very appreciative of it.
There is such an eagerness to young healthcare professionals, nurses and physicians, to not only learn the clinical way we treat things like pain and suffering, but to learn to connect with patients and families in a deep emotional way, to show them that touching patients, holding patients, spending time with patients is really part of what will make you a good physician and a good nurse.
And that's what the therapeutic process is here, is really putting those patients' needs first and really getting to interact with them. And you get to see the families, and you get to really understand who this person was, besides just the person at the bedside. You really get to treat them as a person, not just a patient.
I purposefully chose to come to Calvary. I had a couple other offers at other hospitals, but I chose to come to Calvary because I liked what Calvary stood for. Another good thing too is that I feel like everyone takes pride in their job, in their position, and you can kind of tell that, it's their hearts that truly brought them to work at a place like Calvary.
We've been teaching palliative care since the mid-'80s to doctors and nurses, not only from the New York metropolitan area, but internationally. It's what we do best, and I think we need to continue to be a leader in teaching palliative care.
6 months into this residency program has been fantastic. We have some of the best doctors here at Calvary Hospital, some of the best nurses, and really to be able to engage in them in the manner that we do makes it all the more rewarding, because now you could take that textbook knowledge and really put it into practice.
We are extremely pleased with our residents. They are partners with us in designing this, and they have stepped up to that. Their level of curiosity, their willingness to jump right in, learn everything they can, is inspiring. It's a very mutual experience, and that's something that makes me very, very happy. So, am I happy with this program? You better believe I am.
I love working with the people that I work with. I love working with the families. I love taking care of the patients, and I really wouldn't have it any other way.